let's talk about the introductions to psychology and historical view. So, let's define abnormal behavior. Abnormal behavior, it may be defined as behavior that is disturbing or socially unacceptable, distressing, maladaptive, or self-defeating, and often the result of distorted thoughts or the cognitions. So, there are several perspectives and furious attempts to explain the causes of abnormal behavior. These are the behavioral perspective, medical perspective, and other psychological perspective. Let's move on to the mental disorders, which also called mental illness. These are the conditions that affect our thinking, feeling, mood, and behavior. They may be occasional and long-lasting, or we also called chronic, which affect our ability to relate others and function each day. So the causes of mental illness is it will occurs from the interactions of multiple genes and other factors such as stress, abuse, or a traumatic event, which can influence or trigger an illness in a person who has inherited susceptibility to it. Let's move on to the psychopathology. This is study of nature or symptomatology, and also it refers to the terms the study of mental illness or mental distress or the manifestation of behaviors and experience which may be in the active of mental illness or psychological impairment. Well, there are many different professions may be involved in studying mental illness or distress. And there are challenges of study of psychopathology, maintaining objectivity, avoiding preconceived notions, reducing stigma. So now let's move on to the characteristics in the DSM. Personal distress, disability, violations of social norms, and dysfunction. Which personal distress, according to, is a person's behavior may be classified as disordered if it causes him or her a great distress. Disability is an impairment in some areas of life. Example, these are the personal relationship. Can also characterize mental disorder. Impairment is set in the context of person's background. Violations of norms. Reaction is outside social norms. Something is considered as abnormal because it is occurs infrequently, deviates from the average. So, what is stigma? Stigma refers to the destructive beliefs and attitudes held by a society that are ascribed to groups considered different in some manner, such as people with mental illness. There are four characteristics of stigma. This the distinguishing label is applied. Label refers to the undesirable attributes. People with the label are seen as different. People with label are discriminated against. So, psychological dysfunction. It is a breakdown in cognitive, emotional, or behavioral functions, but considered to be being a continuum or a dimensions rather than to be categorized. Then, Diagnostic and Statistical Manual, DB, or what we call DSM. It is widely accepted system used to classify psychological problems and disorders. DSM contains diagnostic criteria for behaviors that fit a pattern, cause dysfunction and subjective distress, present for a specified duration, and for behaviors that are not otherwise explainable, or called abnormality defined. So, DSM describes behavioral, psychological, and biological dysfunctions that are unexpected in the cultural context associated with present distress and impairment in functioning, or increased risk of suffering, death, pain, or impairment. So, psychological disorders is or psychological abnormality is a mental illness, less preferred term, approaches the specific study of psychological disorders. There are a lot mental health professionals. The PhDs are the clinical and counseling psychologists. The psychological doctors, clinical and counseling doctors of psychology. The RPS or registered psychologists. MDs are the psychiatrists. A psychiatric and non-psychiatric social workers or MSWs. MN or MNS, psychiatric nurses. The lay public, clinical description, etiology, treatment, and outcome in the psychology. So, clinical description. How many people in the populations as a whole have the disorder? So, it is needed to know, in this sense, how many cases occur during a given period, such as a year. Onset. How's the beginning of the disorder? Acute onset or indicious onset? Course. Disorders follow a somewhat individual pattern. Chronic course, episodic course. Time-limited course. Etiology. What contributes to the development of the pathology? That is what we call etiology. Treatment development. How can we help alleviate psychological suffering? Includes pharmacologic, psychosocial, and or combined treatments. Prognosis, the anticipated course of a disorder. Treatment outcome research. How do we know that we have helped? Limited in specifying actual causes of disorders. So, let's move on to the history of psychopathology. Demonology. The doctrine that an evil being or spirit can dwell within a person and control his or her mind and body, thereby can be treated by exorcism, the ritualistic casting out of evil spirits. So, cutting holes to the skull in the belief that evil spirits can outcome is what we call trephination. Patients were shocked back to the senses by being submerged in ice or cold water, is what we call hydrotherapy. Early biological explanations. During 5th century before Christ, Hippocrates so mental disturbances have natural, not supernatural causes. This during Hippocrates' success during 5th century before Christ. There are 3 categories: mania, melancholia, and phrenitis. 4 humors are the blood, black bile, yellow bile, and phlegm. So let's move on to the Dark Ages, which the churches gained influence and the papacy was declared independent of the state. Christian monasteries, through their missionary and educational work, replaced physicians as healers as authorities on mental disorders. Monks cared and prayed for mentally ill, concocted potions. So, the precautions of the witches. Witchcraft was viewed as integrated by Satan, was seen as heresy and a denial of God. Those accused of witchcraft should be tortured. Historians concluded many of the accused were mentally ill. So, during the lunacy trials, it was begun on 13th century at the England. Municipal authorities assumed responsibility of care of mentally ill. Trials held to determine sanity. The trials were conducted under the Crown's right to protect the people with mental illness. What what is lunacy? Lunacy attributes insanity to misalignment of moon and stars. Mass hysteria, characterized by large-scale outbreaks of bizarre behavior. Which in Europe, whole groups of people were simultaneously compelled to run out in the streets, dance, shout, rave, and jump around in patterns as if they were at a particularly wild party late at night. Still goes as rave, but without music. Behavior was known by several names including Saint Vitus, Dyson, and Tarantism. So the development of asylums. Asylum, it was establishments for the confinement and care of mentally Priory of St. Mary of Bethlehem during Ondasan 243. One of the first mental institutions origin of the term Bidlan. Eventually became one of the London's great tourist attractions. Treatment non-existent or harmful of asylums. Early medical treatment could be harmful. Benjamin Rush recommended during copious amounts of blood. Penal reforms and moral treatment. Philip Pinel exists on 1745 to 1826. Pioneered humanitarian treatment at La Bicêtre. Pinel is said to have begun to treat the parents as sick human beings rather than as beasts. So, early foundations, biological approaches. General paresis. It was a degenerative disorders with psychological symptoms caused by syphilis. Since general paresis has a biological cause, other mental illness might also be seen. So, genetics. Galton's work lead to notions that mental illness can be inherited. As a behavioral genetics, to the extent to which behavioral differences are due to the genetics. Eugenics. Those are promotions of enforced sterilizations to eliminate undesirable characteristics from the population. Many state laws required mentally ill to be sterilized. Insulin coma therapy. It was Manfred Sackell, 1926, who found it. Electroconvulsive therapy, or ECT, was conducted by Sir Litty and Benning on 1938, induced epileptic seizures with electric shock. Prefrontal lobotomy. Gigas Moniz, 1935, often lead to listlessness, apathy, and lack of some cognitive abilities. So, since the beginning of scientific inquiry into mental disorders, supernatural, biological, and psychological points of view have bid for attention. Psychological viewpoints emerged in the 19th century from the writings of the classic psychologists, including Charcot, Breuer, Freud, Jung, Adler, and others. Behaviorism came out later and suggested that behavior develops through classical conditioning, operant conditioning, or modeling. These were propagated by the likes of B.F. Skinner, Watson, and others. The study of thinking and cognition came much later. So, different mental health professionals include clinical psychologists, psychiatrists, social workers, counselors, and mental health therapists, which involves different trainings and programs and different links in with different emphasis on research. Psychological assessment, psychotherapy, and psychopharmacology.